Welcome. A very, a very good evening
Yes,
to
sir.
all the eminent doctors for today's webinar. Our endeavor is to spread awareness about the rabies, which is much fatal but can be avoided once appropriately vaccinated. This is an initiative from Cadila through its innovation to serve the society and humankind. The topic of today's webinar is the novel 3-dose G protein vaccine, ultimate key for compliance. Dear doctor, rabies is the world's first 3-dose anti-rabies vaccine. With its 3-dose, we would like to inform you that Rabies has successfully completed 1 year of launch, with more than 40,000 of the animal bite victims being vaccinated, and the compliance was recorded and no case of ADRs was registered. With this, it is my honor to introduce you to the speaker of today's webinar, Dr. Ganesh Tandia sir, who is an MD Medicine, and he is also a former API member as well as IMA member, and also serving the society as well as humankind since last 10 years in the medical field. So now I would like to request Dr. Ganesh Tania sir to initiate the talk, and later on we'll have the question and answer session. Over to you, sir.
Thank you. Welcome to all respected doctors, my seniors and colleagues. Myself, Dr. Gangesh Tandia. I am working as a PG medical officer at in MD Medicine and at District Hospital Sadol. We are we today joined here to study related with rabies. As you know, that rabies is a 100% fatal disease, and so far there are many datas are here in which rabies kills almost 59,000 people globally in a year, and in which 97% of the death is caused due to dog bite. In India, WHO said that 20,000 deaths in only happened in 2018. So that you can you know that how much this rabies is a serious problem in India, in which now we in which 1/3 of the bite and complications related with rabies occurs in UP, MP, Chhattisgarh, Bihar, and Assam. Now we come to the current management which we are getting in our hospitals and in our scenario. When there is any dog bite happens, it is there is a first aid in which local wound management we do, like by washing the wound, extensive washing the wound with the help of soap and waters, in which primary treatment done. Another management of management is active immunization, that is post exposure prophylaxis, in which and another type of treatment is passive immunization. So post exposure prophylaxis is important for dog bite, because any other treatment is here related with rabies. What happened in the current challenges with the post exposure prophylaxis? Important thing is that we took 5 doses of vaccination after the dog bite, and it is very problematic to complete the dose, and the compliance is very poor with the post exposure prophylaxis, which is we taken for about 5 doses in a 1 month. All the post exposure prophylaxis current in a study done in the Safdarjung Hospital, New Delhi. number of in which the 360 annual bites were there, in which 40%, in which 48% of the patient were non-compliant, and 46% were compliant, and 6% were delayed compliant. This is the problem which that treatment did not complete all the patient, that results in poor compliance of the patient and treatment. That means overall 53% of non-compliant of full course of anti-rabies vaccine as a prophylaxis. Another study done at the Bangalore Municipal Corporation Hospital, in which in 1 month, as we know, there are in 1 month total 5 doses are there, and 0 dose, matlab first day followed by day 3, then day 7, then day 14, then day 28, in which compliance of the anti-rabies vaccination were in first day there are 100% vaccination were there, but up to reaching on the, day 3, there is 88% patients were taken vaccine, followed by on the day 7, the percentage of taken post exposure prophylaxis were reduced to 85%, followed by after 14 days 70% persons or patients were taken treatment, and after 1 month there is a the study showed that 60% of the patient taken the treatment. This shows the poor compliance of the anti-rabies vaccine, which in which 5 doses are taken, and overall 60% of the total vaccination which are taken, or this shows the poor compliance. Overall, the compliance rate of intramuscular rabies vaccination was 60%. Or now we come to the why there is a problem related with the poor compliance. So there are many things like there are many childs related with dog bites. So first 11% of the school timing were there, and some shows 11% that distance from the hospital, they are unable to reach the hospital for vaccination. Some person forget that dates what happened this is my time to or schedule to for vaccination, and some other 47% cause that's there are many causes that they forgotten, or there are many personal issues that they lost the for their vaccination dates. Now now evolution of rabies vaccination, how the rabies vaccination started, and what are the what type of vaccination were started since 1885, in which in 1885 first vaccination was started as a live attenuated vaccine, then again started as then rediscovered as a 1911 it is inactivated vaccine, followed by since 1976 we are using cell culture vaccine that is inactivated. Now our topic for which we are here is our novel 3-dose recombinant rabies G protein vaccine, which is introduced as rabies vaccine, in which rabies vaccine or G protein vaccine is started as first protein subunit vaccine. It is prepared by virus-like protein platform technology. It is in this very important thing is that it is first vaccine with 3 doses of intramuscular regimen, which is of 037 days. This leads better compliance due to easy to flow regimen, and very important thing, less visits, and it is very convenient, ready to use, already constituted. That means no need to reconstitution. This is the very important thing. for our novel 3-dose recombinant vaccination. Now, what is virus-like protein, virus-like particle technology, in which this protein is a G protein, which is discovered through native virus, in which G protein is discovered as by using virus-like particles technology, and it is stabilized, and it is similar to native virus particles, not like simple virus particles. It is virus-like particles, and they are capable to introducing strong humoral and cellular immunity. That means virus-like particles as our vaccine. Now, there are some clinical trials in comparative to 3-dose vaccine and 5-dose vaccination, in which the seroprotection coverage by our 3-dose vaccination in day 14 we get almost 100%, in which in other type of 5-dose vaccination, on the day 42 we get 100% of vaccination coverage, and other and on the day okay. Another study shows that in which randomized comparative control multicentric study, in which total 800 total subjects were taken, in which rabies injection, that means 3-dose rabies vaccination, in which 037 days regime was completed, and Rabipur, which contains 5 doses of rabies vaccination, which taken to 67 subjects. Non-inferiority, the results are consistent across different age groups and gender. Observe different 1.52% with the pre-specified margin of 4%. Non-inferiority for seroprotection, primary and endpoint day 14 and 42 were met. That means test and comparator are identical in seroprotein rate both on day 14 and day 42. Has better safety profile as compared to all reference vaccine which are running 2 days. So this is the overall novel 3-dose found to be safe and immunogenic, and was comparable to 5 doses of WHO pre-qualified vaccine. And this is the recommended to 3-dose vaccination for our rabies. Thanks to all.
No, sir.
Chandia has finished his topic. Now I will ask the viewers to please ask the question if you have any.
हेलो सर, टेक्निकल सपोर्ट से बात कर रहा हूँ। कोई प्रॉब्लम आए तो बता दीजिए।
जी yes.
कोई प्रॉब्लम आए तो बता दीजिए सर।
नहीं, अभी कोई इशू नहीं है।
ओके सर।
So, rabies is our new vaccine post-exposure prophylaxis for 3 doses on 037. That means only 1 week dose regimen. That means in 1 week we take complete treatment. That means good compliance and better compliance comparative to conventional or reference vaccine. There is a randomized controlled trial in which there is 800 people were taken, in which 533 subjects were taken 3 dose regimen rabies injection, and 267 subjects taken Rabipur 5 dose vaccine, and there in comparatively the best and safe efficacy with equivalent seroprotection was related with rabies injection, which was a 3 dose vaccination. That means good compliance, compatible and convenient, already constituted vaccine. No need to reconstitution for injection or preparation. Just 3 dose in 7 days for good compliance. That means rabies injection.
हेलो संभवी सर। हेलो हेलो संभवी सर, सेशन कंप्लीट हो चुका है।
Hello, sir. Hello. Hello, sir. I am from technical support. Hello, sir. Hello.
हेलो।
सर मैं टेक्निकल सपोर्ट से बात कर रहा हूँ।
हाँ जी, हाँ जी।
हाँ सर, मीटिंग एंड
आई
करना
थिंक
है।
इट्स ओवर नाउ। अभी कोई ज्वाइन नहीं कर रहा है, ओवर हो जाएगी।
हाँ हाँ ठीक है सर, एंड कर दिए ना मीटिंग।